Mental health concerns among high school students in the United States were worsened during the COVID-19 pandemic, according to survey results published by the U.S. Centers for Disease Control and Prevention. Now, there have been significant increases in high school students reporting persistent feelings of sadness or hopelessness, considering suicide or attempting suicide over the past decade. And findings from the new CDC survey suggest youth mental health was even worse during the pandemic. Overall, more than 37% of high school students in the United States experienced poor mental health at least most of the time during the COVID-19 pandemic, the CDC survey found. Well, for more on this, let's bring in mental health advocate Vanessa Adebayo. Hello, Vanessa. So good to see you. Now, let's indeed begin with mental health. Now, it seems to be one of those issues that a lot of us don't take seriously until we have to. But nowadays, it's a topic many are talking about. But really, what does it mean to have a good mental health, and why is it so difficult for many to indeed have a sound mental health these days?
Thank you so much for having me. So when we talk about mental health, we're talking about your emotional and psychological state, or your well-being, your state of well-being. Many of us haven't really discussed mental health until post the pandemic, but I think obviously during the pandemic, it gave a lot of young adults, especially students, even adults, an opportunity to be able to address it, simply because life was at a standstill and we had to. We had more time to be able to think about it. We had more time to be able to process our environment and the things that were happening around us. And we had time to also process the effect of the pandemic and the effect of the global state of the world at the time individually. I think it's so important that we are able to address our mental health because it helps in the way that we interact with people. It helps the way that we show up to our workspaces. It affects the way that we interact with our loved ones and our friends. It allows us to be our most productive self when we have good mental health. And so overall, I mean, especially during the pandemic, when we weren't operating at our full capacity and we had to take a break or be at standstill, it allowed us to really understand what state of mind we were all in at the time.
Interesting, Vanessa, but it's very, very worrying taking a look at these studies. Now, we're talking 37%. Now, the study said high school students have been experiencing more sadness and hopelessness, and it's gotten worse due to the pandemic. So what are the cracks in the system leading to this crisis? Why this very high percentage at 37%?
Yeah, so I mean, it's alarming, right? And when we look at the statistics, you see 1 in 5 young people are more likely to have or suffer from a mental illness. You also see the suicide rate from ages 14 and up has increased tremendously in the last couple of years. I don't know if we can necessarily say there's a crack in the system. Yes, there needs to be more mental health awareness. There needs to be more mental health professionals. There needs to be more mental health education in schools. But I think overall, we also have to understand the environmental factors that took place within that time that led to this increase of mental illness. You see young students experiencing grief, right? When we say grief, a lot of people initially, allude to the fact that maybe someone is, losing or suffering from a loss of a loved one, or, something traumatic has happened. But grief can also be experienced when your regular routine is taken away from you. So these students, being able to not go to school, stay at home, be subject to the environmental factors in which some of them are experiencing domestic violence or domestic abuse. Some of them are worried about the state of their parents' financial ability to pay the bills. Some of them are dealing with low self-esteem. They're being, taken away from their friends and their regular routine. These are all things that added to it. Thankfully, as we see, things have started to kind of pick up and our regular routines are now beginning to resume. Students are now being able to return to school and get back into the rhythm of things. But I think as far as the system is concerned, we have to understand that at any point in time, especially at a vulnerable state 14 onwards, we need to be able to educate parents and the students specifically about the importance of mental health. Because it's one thing to experience trauma or anxiety or experience grief, but if you can't put a name to it and you don't know the right professional or the right avenue or intervention to be able to use, then it is no use to anyone, and that's why we have an increase in suicide, because a lot of people don't know how to deal with these things. They don't even know who to turn to. So I think it does require a lot of programming in schools and a lot of education, and of course a lot of mental health professionals stepping up to the plate, a lot of different means of therapy as well. Some students can't afford financially to be able to see a therapist, but offering different apps, being able to do virtual therapy, these are all means of people being able to seek help, even if they can't be there physically to receive it.
Well, another very worrying phenomenon is that our sisters, daughters and mothers, were found, including the LGBTQ adolescents, found to have experienced these symptoms at a higher rate than their peers. Talk to us about that.
Yeah, I think that it's very evident, right? As women, as LGBTQ, community, you realize that they're minorities, right? They may not have the right resources or tools available to them. And then more importantly, do I find someone that looks like me, that understands what I am experiencing at this time? You realize that as a woman, we also have so many different roles we play as mothers, as employers, as bosses, as entrepreneurs, as wives, as girlfriends, as support systems, whatever it is. We wear so many different hats. And so being able to kind of stop and be able to understand exactly what it is that you're experiencing at the time, it really requires, one, some sort of self-awareness, but then two, it requires people being able to really come down to your level and understand where you're coming from. I think when you're talking about minority communities like women, like the LGBTQ community, when it comes to Blacks, whatever minority community you're addressing, they need to find people that look like them, that understand their journey, understand where they're coming from, and understand what it is that they're going through. Otherwise, once again, it's very hard to seek help, especially when it comes to your mental health.
Well, now that we know the problem, Vanessa, what can be done? And do you think things can improve when it comes to addressing these issues?
Yeah, I definitely think things have started. Over time, there's an increased awareness about mental health. Even this conversation alone is so important, so that people understand that there's no shame or stigma with dealing with your mental health. We all have mental health. No one is it doesn't fall, and no one is, what word am I looking for? No one is excluded from this conversation, sorry. And more importantly, we need to be able to continue the conversation, but we need to also continue to push it in policy, because without the backup of policy or the mental health professionals to be able to support this movement, then once again, it's all just talk and no action. It's one thing to address mental health, but there's another thing to be able to actually find the tools and resources to be able to solve it, right? And I think it's important that we have policy in place that addresses our mental health, but then also is able to address people who may not be able to afford certain mental health care, and being able to bridge that gap through different, forms of intervention, whether it's virtual therapy or through app development or through the advancement of technology. Whatever it is, it needs to be put in place and on paper, so that globally, but then specifically even in the young, teenage or young adult community, we're able to get them at a young age and be able to implement this intervention, so that these issues do not build up and then eventually lead to suicide.
And on a final note, well, we all think, it's time we do something about this, and we definitely also want to do something. But exactly where do we start? Do we need new policies, new legislations to help us out? Or perhaps, those policies and laws that we have, are they good enough for us to run with?
No, I think globally, when we think about the budget that is allocated towards mental health, it's very low. I don't want to speak specific to a country, but we can improve, right? When it comes to policy, we can improve when it comes to legislation, we can improve when it comes to resources available. Ideally, I think the first step is having conversations like this and bringing this to people's attention, understanding that this is affecting people at an alarming rate. People are dying. We have to address this, not tomorrow, but now, and having awareness campaigns, being able to have conversations about the way that mental health is affecting our young people, our young adults, is the first step so that people are aware. And the second step is then having advocacy groups, talking about the ways that people can then address their mental health to be able to improve the mental health all around, especially when it comes to young people. And then eventually, advocacy then turns into change of policy and legislation, being able to offer people the right resources, the right money to be able to be allocated towards the budget so that everyone has equal opportunity to be able to seek good mental health care if and when needed.
And just to throw this one in, if I do not feel good with myself and I do not like the way that I feel, what exactly must I do to take care of my mental health?
So number one, prioritize yourself, prioritize your self-care, prioritize your well-being at all times. When I tell people this all the time, when you go to work and you are under pressure and you feel that you have to perform, or when you go to school and it seems like you're supposed to be a student and you're supposed to, make good grades, at the end of the day, if you are not at your full maximum best self, you can never do any of that, number one. Number two, if God forbid you were to die or faint or fall or get sick, guess what? Life still continues. Everyone still goes about their day. It is so important that we pause and we rest and we take care of ourselves. What self-care looks like is going to look like, it's going to look differently to whoever, you're addressing. Self-care for me could be me walking, taking a walk around my neighborhood. Self-care to you could be you taking a nap. Another person, it could be them going for a spa day. Whatever it looks like for you, find it. Find the spaces that allow you to be able to be at peace. Find the spaces that allow you to be able to rest. Find the spaces that allow you to be able to offload whatever pressures or whatever stress that it is that you may be experiencing. But find the mechanisms and the things that make you happy, but more importantly, allow you to be able to perform at your maximum and best self at all times. Because if you're not taking care of yourself, you can't pour into anyone else. It is so vital and important that we prioritize ourselves. If you don't know what to do, call a friend, call a practitioner, call a therapist, call a counselor, call somebody in your clergy that maybe, can be able to direct you to the right things that you can do. But whatever it is, seek the help and prioritize it so that you can be your very best self and you can be able to pour into people as much as you pour into yourself.
Well, thanks so much, Vanessa Adebayo, mental health advocate. Well, I sure believe that this has indeed helped save somebody now.